Hello, my name is Snail Desai. I will be talking about thromboembolic disorders. These are things like the VTE, PE, and DVT. What is VTE? VTE is essentially venous thromboembolism. It's an umbrella term for disorders like the pulmonary embolism or PE and the deep vein thrombosis, DVT. So we'll look at the differences between these two. Um, these are the topics that you probably already know this, but these are the some of the main topics covered for the NAPLEX. So it's important to at least have an idea of how each of the topics how to understand each of the topic and medications that's used in each disease state here. And like I said, some of the medications are similar between one disease to another. So definitely knowing those differences as well is important on the test. So what is VTE, PE, and DVT? VTE stands for venous thromboembolism. It's where the blood clot that forms in the vein travels and can also travel to other parts of the body. So once a clot forms, it can break off and travel another place and cause further problems as well. So, there could be things like a heart attack, a stroke, a peripheral artery disease. Any of those can happen when a blood clot forms or ruptures and then breaks off and it goes down the vein to other parts of the body. So that's how VTE occurs. DVT is essentially the same as VTE. It's just DVT is more dealing with the deep vein thrombosis. So the clot formation occurs in the deep veins, such as like in the legs or the pelvis area, more on the peripheral parts of body. So uh, usually the legs, though, in this case. Pulmonary embolism, as you can see in the term pulmonary, you're dealing with more of the lungs. So the clot breaks off and travels to the lungs, which can also lead to damage in that part of the body. Um, there are some risk factors that might lead to VTE, which is usually described by something known as a Virchow's triad. So you'll see a diagram here. This is the Virchow's triad, and what it's showing is three different sections here. You got hypercoagulability. These are usually things like if some patient is going under a surgical procedure, major surgery, trauma, a patient is pregnant, has infection and sepsis and all those kinds of things, dehydration, inflammation, circulatory stasis. Stasis, like kind of like someone who is immobile, not moving, and staying in one place. Someone is on a flight, sitting on the flight for a long duration. They're very immobile. They could experience, those kinds of symptoms of DVT as well. So, venous obstruction, depending on like obesity, if there's like cancerous tumor in the body, pregnancy, those kinds of things. Some of these things overlap. Um, Varicose veins, um, that's another representation of causing a VTE. AFib or left ventricular dysfunction. So these are some of the ways that VTE may occur. Um, in terms of vascular damage, you can see here vascular damage could be dealing with some other types of disease states, cellulitis or thrombophlebitis or um, indwelling catheter or heart valve, something to do with the heart valve. So some other parts dealing with the vascular part in the body might lead to a DVT or VTE as well. So it's important to distinguish the differences between some of these sections on the virtual triad, but overall, you could see there are some overlapping parts here. Um, but it's at least you have a familiar idea. If you see a patient case, at least you could tell what is occurring in each of these sections. um, so let's take a look at some of the medications and treatment options for VTE. So we already discussed the uh, we already discussed some of these medications already in my previous lectures, um, such as the fractional heparin, low molecular weight heparin. We discussed about fondaparinux, um, warfarin. I'm going to discuss a little bit of direct oral anticoagulants in this section. It works the same way as like the low molecular weight heparin, unfractionated heparin, but it doesn't go. It's not actually the only drug. Like it's not the only class. So this class is divided into two main groups or categories. You got the factor 10A inhibitors, and these are things like rivaroxaban, apixaban, edoxaban, and betrixaban. Um, you can make it however you like. You can make it as READ as an example, READ, to represent the factor 10A inhibitors. And then there's a factor 2A inhibitor or a thrombin inhibitor, and that is the dabigatran or Pradaxa. So that all of these are examples of the DOACs, direct oral anticoagulants, that you should be familiar of. You can see here in this diagram, it's the same diagram. I just pulled it from the slide in the previous presentation I had given previously, where you have like the blood vessel here, and these are all the different platelets, and you have the blood red blood cells here. But in this case, you also see factor 10A and factor 2A. DOACs target both the factor 10A and the factor 2A proteins in this blood. So unlike the unfractured heparin that targets the AT3, the DOACs just target directly the factor 10A and factor 2A or factor 2A. So just understand that there isn't really so much more to this mechanism. It just works directly to that versus the unfractionated heparin. Most of these target directly to a protein. The only one that's indirect, as you already saw earlier, is the fondaparinux. That one indirectly targets the factor 10A protein. So that's pretty much it in this